So what is the sexual self? You know, again, I think when I say the word sexuality, what comes to mind for many of you? Sex. Anything else? Intercourse. Anything else? The whole thing, the whole process, feelings, sensations, emotions, connection, right? Disconnect even sometimes. So when I think about the sexual self, and what I was interested in looking at when I studied specifically young adults and the impact that cancer had on their view of self, is we all have sexual bodies. How we use our sexual bodies differs and varies depending on culture or religion or our families. And the way we think about our bodies influence the way that we feel about our bodies, which then influences our behavior. So if I wake up in the morning and I look in the mirror and you go, oh my gosh, Sage, you look like that again, right? What is that telling myself? It's telling myself that something's wrong, something's broken, something's ugly, something's nasty. How does that then make me feel? Probably sad. Probably withdrawn is the behavior that I might do. I might not take that extra step to help myself feel better because I feel negative. My morning starts with that negative thought. So when I talk about the sexual self, I'm not just talking about intercourse. I'm not just talking about having a body that has sexual sensations or things that change related to a breast cancer diagnosis. I'm really talking about the way we think about our bodies. And one of the greatest things that cancer cannot take is our brains. Whether it's the removal of the breast, whether it's a breast alteration, a lumpectomy, hair loss, right? Nobody prepares you for pubic hair loss either, right? I mean, for many women, that's a shocker. And can, for some, have a negative impact on the way they view their bodies. So hair loss, body changes, weight gain, weight loss, stretches, stretch marks, all those things can be altered by a cancer diagnosis, specifically a breast cancer diagnosis. And then the psychological distress. We know that distress is common in women and men diagnosed with cancer. In fact, 15 to 25% more common. And what is distress? It's that high emotive state, right? High depression, higher anxiety, higher physiological expression or somatic experiences where we might feel the pain and anxiety in our chest. We also know that the cancer treatments itself impact sexual function. How many of you were premenopausal prior to your cancer diagnosis? And how many of you who were premenopausal were told what the effects of chemotherapy would be other than you might get thrown into menopause? Did anybody tell you that you might have vaginal stenosis or vaginal dryness? So when I hear women, when I'm working with them, oftentimes what I hear is, well, I knew I was going to be put into menopause, but when I think about menopause, I think about my mom. And what do I think about with my mom? I think mood changes, she gets kind of moody. Weight gain, complaining, the menopausal pooch. I remember her saying that a lot. The hot flashes, right? And it may be some libido changes, but I don't think about vaginal dryness or vaginal stenosis, the narrowing of the vaginal canal. I don't think about that when I think about menopause. Now I do because I understand it. So we know that cancer therapies can alter physiologically your bodies and your sexual bodies and your sexual function. Your nipple sensation may change, your nerves may differ, right? If you have neuropathy in your feet and your hands, that can affect the way you feel about your body. And then we know that chemotherapy is a drying agent. And so how many of you get dry mouth often? And your skin gets dry, right? Well, the vagina also gets dry. We know that the other physiological changes that happen besides the acute or premature ovarian failure are fatigue, pain, decreased stamina, and even just to do intimate activities with our friends, we typically need stamina, right? To go out to dinner with our friends, you need stamina. Those are intimate relationships that get altered when you're in the middle of treatment. And if you're on chronic treatment or long-term treatment, you've had to learn how to adapt your life around when you know you're going to have a bad week or a good week, a bad day or a good day. And sometimes that's predictable, and sometimes that rug gets pulled out from underneath you and you don't always know.